Congenital adrenal hyperplasia is a high-yield topic that is being frequently tested on the Step 1 exam, but then students are sometimes getting confused regarding the symptoms that arise from defects of any one of the enzymes that are required for the production of these hormones. So here I would like to discuss the topic in a little more detail in order to make the understanding and memorization of the symptoms easier. So just to provide some background information, the adrenal gland is made of a capsule that surrounds the adrenal cortex. And then inside we have the adrenal medulla. Adrenal medulla is producing epinephrine and norepinephrine. The adrenal cortex, on the other hand, is made of 3 layers. The outermost layer is called zona glomerulosa, which produces aldosterone that is required for the absorption of salt. Then we have zona fasciculata that produces cortisol, which regulates blood sugar. And then finally, the innermost layer of the adrenal cortex is zona reticularis, which produces androgen, that is a sex hormone. And so one memory aid that makes the memorization of the order of these hormones easier is that it gets sweeter as you go more inside. So from outside, salt becomes sugar, and then finally sex. So it gets sweeter as you go deeper from the adrenal cortex surface to the inner layers. Now, for the production of every one of these hormones, certain enzymes are required. For instance, for the production of aldosterone, 11 beta and 21 hydroxylase enzymes are required. For production of cortisol, 11 beta, 21 and 17 alpha hydroxylase are required. And then finally, for the production of androgen, 17 alpha hydroxylase is required. Now, here I have a question for you. Why is it that defect in any one of these enzymes causes adrenal hyperplasia? And so the answer to your question is that as there is defect of any one of these enzymes, whether it's 11, whether it's 21, or whether it's 17, there would be decreased production of cortisol. As a consequence of which, the pituitary gland will increase the production of ACTH that will act on the adrenal gland and cause its hyperplasia. So therefore, defect of any one of these enzymes will lead to adrenal gland hyperplasia. Now from this point on, you will have to know how defect of any one of them, whether it's 11 beta, whether it's 21, or whether it's 17 alpha hydroxylase, will produce certain phenotypes. And this is the part that gets tricky. And then if you want to memorize it the way it is, I agree that it would be very hard to relate every one of these enzymes to their specific symptoms. But here I'm going to show you a table which makes the understanding of the topic much easier. And so all you will have to do here is to memorize the order of these numbers: 17, 21, and 11. So if you can memorize this table, then the understanding of the topic is really easy. And if you forgot the order of these hormones, we just discussed that it gets sweeter as you go deeper. So first we had the salt hormone, then the sugar hormone, and then the sex hormone. Now let me ask you a question. What happens if there is a defect of the 17 alpha hydroxylase enzymes? So if there is a defect of 17 alpha hydroxylase, therefore cortisol and androgen would not be produced, and therefore there would be excess production of aldosterone. So if there is an excess production of aldosterone, these patients will have too much sodium absorbed, which causes high blood pressure. There would be too little potassium, as a consequence of which there would be weakness of muscles in these patients. And then finally, since there is low production of androgen, there would be ambiguous genitalia in males. So males will have ambiguous genitalia. And if you want to be a little more specific, these males will have a female external genitalia with a blind vagina. Females, on the other hand, will have primary amenorrhea with the lack of the secondary sexual characteristics. And then the reason for this finding is that male hormone androstenedione will be converted into estrone by the aromatase enzymes. So if the male hormone is not present, therefore the female hormone estrogen will not be produced, and so females would also be affected with the amenorrhea as well as lack of the secondary sexual characteristics. Alright, now let's try a different enzyme deficiency. So again, what was the order of the enzymes that we should be writing here? 17, 21, and 11. And could you tell me once again what these numbers tell? So enzyme 21 and 11 hydroxylase will produce aldosterone, 17, 21, and 11 will produce cortisol, and 17 alpha hydroxylase produces androgen. So we already discussed what happens if there is defect of 17 alpha hydroxylase. Next, I would like to discuss what happens if there is defect of the 21 hydroxylase enzyme. If there is defect of this enzyme, therefore there would be low production of cortisol and aldosterone, but then excess production of androgen. And so due to low level of aldosterone, there would be low level of salt, and so therefore there would be hypotension in these patients. And then there would be also excess potassium, so hyperkalemia would exist. Now, since there is excess androgen, males or females here would develop virilization, while females would have ambiguous genitalia. And then the final enzyme that we are left to discuss is the 11 alpha hydroxylase. So let me draw that again. Here we had 17, 21, and 11. So if there is now 11 beta hydroxylase deficiency, there would be lack of aldosterone and lack of cortisol, but excess production of androgen. So excess production of androgen will cause virilization. But then one very important finding that you should know here is that despite there is low level of aldosterone production, there is an excess production of 11 deoxycorticosterone, which is a mineralocorticoid that will increase absorption of sodium and increase secretion of potassium, as a consequence of which there would be hypokalemia. So therefore, patients with 11 beta hydroxylase deficiency will have virilization symptoms as well as hypertension with hypokalemia. So be careful of that. Despite there is low level of aldosterone, since there is increased production of 11 deoxycortisone, which is a mineralocorticoid, there would be hypertension and hypokalemia. And that concludes our discussion of this topic. So basically the take-home message is that if you can memorize the order of the enzymes that I just discussed with you, then the understanding of the symptoms that arise from defects of any one of them is very easy. So what was the order of hormones on the top? Just to give you a clue, it gets sweeter as you go deeper. So first we had aldosterone, then we had cortisol, and then we had androgen. And then what was the order of the enzymes? 17, 21, and 11. So if there is defect of 17 alpha hydroxylase, there would be low androgen, low cortisol, but high aldosterone. If there is 21 hydroxylase deficiency, then there would be low cortisol, low aldosterone, but high androgen. And then if there is 11 beta hydroxylase deficiency, there would be low aldosterone, low cortisol, and high androgen. But since there is excess production of the 11 hydroxycorticosterone, there would be increased level of salt and decreased level of potassium. And that concludes our discussion.